Ayan,
Injuries affecting management.
anze.
Eh, Sibeni kukaa toka kuangalia usikize.
Labda naweza kuna vitu za kuuliza So for, for today's lesson from the last interaction which we had. So right now we are going to discuss about clavicle fracture care. So clavicle fracture care, these are injuries commonly known as collarbone injuries, which are prevalent type of shoulder injuries. I'm very sure you are aware of them and you are very familiar when we say clavicle injuries. They can occur due to various factors such as trauma from falls, sports-related injuries, or motor vehicle accidents. So those are some of the causes of these clavicle injuries. So clavicle fractures are among the most common types of clavicle injuries and can significantly impact shoulder function and mobility. That's where the cases of shoulder dislocation comes in. So the importance of early intervention and proper care. So early intervention is crucial for managing clavicle injuries effectively and preventing complications, which we know when you take early intervention for managing a clavicle injury, at the end of it, it's going to be effective and also it will prevent complications because we can't ignore maybe someone has uh, a shoulder dislocation due to the clavicle, maybe dislocating or or fracturing. So if a person takes early intervention, complications will be prevented. The second one is prompt medical evaluation and treatment, which can minimize pain, promote proper healing, and reduce the risk of long-term disability. So medical evaluation and treatment in cases of person who had a fracture or broken collarbone goes to the hospital, maybe gets medication or some intervention so that to take care of the affected area, which is the clavicle. And this will reduce the risk of long-term disability. That one is proper care, including immobilization, pain management, and rehabilitation, which plays a vital role in optimizing recovery outcomes for individuals with clavicle injuries. Because you cannot be having a fractured clavicle, then you either partaking in a, maybe activities of maybe weightlifting, playing, because when you have that injury and then you're taking part in such kind of activities, it might end up being, oh, turn out to be a different scenario or case because it imposes a high risk. And also, it will not play a vital role in optimizing recovery. Because if you want to recover, you need to follow into the doctor's orders of taking rest. The doctor can't say take enough rest, and then your work is to either maybe play football, carry some heavy things. That will hinder that. And recovery outcomes won't be made. So that's this the overview of the presentation structure. We'll be talking about introduction to clavicle injuries, anatomy, common types and symptoms, and we'll be talking about treatment options, the conservative and surgical approaches, rehabilitation and recovery, exercises, mobility and functional activities. The fourth one is pain management techniques, medications, which are, for instance, ice, heat, therapy, rest. So the fifth one, self-care strategies, we have ergonomics, lifestyle modifications, emotional support. The sixth one is recent research, highlighting the latest findings on clavicle injury management. And then the last part we'll be talking about is biblical perspectives and concluding point on the clavicle fracture care. So the anatomy of the clavicle, this how the clavicle appears, being one of the important bones we have in the body. So this is the anatomy. We have the parts of the clavicle. We have the conoid facet, cortezoid line, the conoid tubercle, subclavian groove. We have the anterior and the posterior clavicle. And then the impressions for postoclavicular ligament. And then the sternal facet for attachment with other bones and articulation with other bones. So the function, these are the functions of the clavicle. The clavicle plays a crucial role in subordinated movement of the arm because without the clavicle, the upper extremities, the upper limbs, they won't be in a stable position because the clavicle itself plays a crucial role coordinating movement of the arms. Because without the clavicle itself put to keep the upper extremities in place, the body itself will be weak and no activities will be carried out. So the second point, it helps transmit forces from the upper body to the arm, allowing for actions such as lifting, reaching, and pushing. The clavicle, as I said, it helps the movement of the upper extremities because it's attached to the limbs, the upper limbs. So to facilitate lifting, reaching, and pushing. Because even when, to give an example, even when maybe weightlifting, you can see how the clavicle is protruding to help that coordination of the arms so that they can maybe help in the weightlifting itself and also reaching and pushing. That one is the clavicle also provides stability to the shoulder joint during these movements, helping to maintain proper alignment and function. Without the clavicles, take a scenario, a person who doesn't have clavicles, maybe it's either fractured or they are not there. So the upper body will not be in balance or maintaining a good posture because Without the clavicle, or maybe the clavicle is affected, it will hinder uh, the proper alignment and the functionability of the upper limbs and the upper extremities because the clavicle keeps the arms, the chest area in place to facilitate these movements. So, sign and symptoms. We have the signs and symptoms. Since we are talking about uh, the clavicle fracture care, so we have the signs and symptoms when a person uh, is suffering from um, the clavicle fracture or clavicle dislocation. So the signs are pain. The first sign is pain, which is typically localized over the collarbone and may worsen with movements or pressure, which the collarbone itself is the clavicle itself. That's another name for the clavicle, which is the collarbone. The pain. Because if there's a fracture on the collarbone, if you try to move or if you try to do some activity, there will be pain if there is that fracture or the collarbone itself is affected. We have swelling, uh, inflammation, and swelling around the injured area because if the clavicle is fractured or at some point broken, it might lead to it protruding, like it wants to come the outside of the skin, so which might lead to swelling and inflammation, which might lead to formation of pus, and also the swelling, also the redness at the affected area. We have tenderness, sensitivity to or discomfort when touching or palpating the collarbone. So if the area is affected, if the area itself is affected, if you try to touch it, since assume a nursing or a medical practitioner is trying to palpate on a patient who is complaining of pain, the collarbone, maybe the patient got an accident or a collision which led to the clavicle, the collarbone to fracture or get dislocated or broken at some point. So if the nurse is trying to maybe palpate so that the patient to express or tell where he or she is feeling pain, and there will be tenderness which will be due to sensitivity or discomfort when touching or palpating the collarbone. There will be bruising, which discoloration or bruising over the injured area due to internal bleeding. If the area is affected, there will be redness or it will be turning bluish because the blood around that area is not receiving enough oxygen due to inflammation, which is caused by the injury itself. So there will be bruising, discoloration, the redness, and the skin turning bluish. Visible deformity, which is obvious a deformity or misalignment of the collarbone. It's a normal scenario case which is usually observed when a person has um, a fractured collarbone or the dislocation. Yeah. So also there will be limited range of motion, difficulty or pain when moving the shoulder joint. Earlier I talked about the clavicle itself facilitates the movement of the upper extremities and the upper limbs. So if the clavicle is fractured, it will limit the range of motion because if it's affected, you can't do a particular activity you want to partake in. So there will be limited range of motion. And then audible symptoms, which will be grinding, cracking sound, the crepitus may be present during shoulder movement. The audible symptoms, the grinding and cracking sound, which will be caused by dislocation, dislocation or a bit of crack on the collarbone. There will be some sound which will be coming from there, which we call the crepitus. So we have for the signs and symptoms, we have the treatment options, and under the treatment options, we have the conservative approach, the surgical approach. So under conservative approach, it's for less severe cases, which clavicle fractures can be treated conservatively through immobilization with a sling or a brace, under which this approach allows the fractured bone to heal naturally over time without surgical intervention. That's under conservative approach, uh, which is based on the severity of the injury or the fracture of the clavicle bone. Because as you can see, it's for less severe cases, and they can immobilize by treatment through sling or brace. The person wearing a brace to reduce the movement and the motion so that the clavicle can detach and heal. The other treatment approach is the surgical way. This for more severe or displaced fractures, of which where if it's displaced, they need to cut through and try to put it into position, of which the surgical intervention may be necessary. This involves realigning and stabilizing the fractured bone fragments using techniques such as opening to reduce the internal, such as open reduction, internal fixation, which may involve the use of plates, screws, or pins to hold bone in place during healing. You have witnessed such kind of cases. I know you have witnessed such kind of cases. Someone broke the had a uh, fractured clavicle, and then the person had to go through surgery so that they can put the bone back into place. Of which the surgical approach, when it comes to surgical approach, since it's severe, it can be treatable by conservative approach, because we saw conservative approach is for less severe cases, but for surgical is for severe or displaced. So rehabilitation and recovery. This is the process, is that process, the healing process for the person to gain normality after having the fracture through an injury or the breakage of the clavicle. So the first rehabilitation to lead to recovery because rehabilitation enhances recovery. So they go hand handy. The first one is exercise. Recovery from a clavicle injury often involves a structured exercise program designed to improve strength, flexibility, and range of motion in affected shoulder. In the case where the doctor prescribes uh, a limited range of motion activities by starting with limited range of motion activities bit by bit, so that because see my patient came from surgery, had a surgery on the clavicle, and then you try to put the patient into lifting heavy weights. It doesn't work like that. It's a ongoing process which is bit by bit, and then the results will be there. Because maybe that time after surgery, a person cannot carry, but after some time, by imposing some exercises, the person will be able to be lifting weights bit by bit, starting from light weights to the desirable weightlifting. As recommended, exercise is recommended and may include a gentle movements such as finger and wrist flexion and extension, shoulder, pendulum exercises, and exercises will improve postural awareness. When we talk about wrist, finger and wrist flexion, extension, flexion and extension, because flexion is the reduction in angle and the extension is the increase in the angle. So, so that's the under the range of motion for exercise. The other one, we have mobility. Restoring mobility in the shoulder joint is a crucial aspect of rehabilitation for clavicle injuries. And then we have functional activities. As recovery progresses, patients can gradually resume daily activities with a focus, with a focus, with a focus. Can I hear that?
Imerudi.
So as I was talking earlier about under mobility, which is the restoring mobility in the shoulder joint is a crucial aspect of rehabilitation for clavicle injuries, which patients are encouraged to gradually increase the range of motion in the shoulder through various exercises and stretching techniques. This may include using a range of motion exercises to gradually increase flexibility and mobility in the shoulder joint, since the clavicle is connected to the shoulder joint. Another one is functional activities. As recovery progresses, patients can gradually resume daily activities with a focus of avoiding heavy workloads or activities that may strain the injured shoulder. As I talked earlier, You can't uh, put a patient who's come from surgery to maybe lifting 50 kilos of weight. So it's bit by bit by performing lightweight activities. We have pain management techniques. We have medication, which encourages mindfulness and relaxation to reduce stress. We have relaxation techniques, which offers methods such as deep breathing, guided imagery, or progressive muscle relaxation. We have ice and heat therapy, trying to cool the area or heat the area. The heat is to hold uh, the clavicle bone, and ice is to maybe to reduce the heat around the affected area. Also, we have rest, which emphasizes the importance of adequate rest and sleep to support the body's healing process. We have supplements. Uh, yeah. We have self-care strategies, ergonomics, by educating on maintaining good posture and avoiding activities that strain the injured shoulder. We have lifestyle modifications, encourage refraining from activities that worsen pain or strain, such as heavy lifting, as I said earlier. We have emotional support, providing patients with emotional support and encouragement through recovery. The same thing, a bit of more information about the clavicle fractures. Uh, these are human quotation. Once you choose hope, anything is possible. As you are going through the recovery process of the clavicle, you need to have hope that at the end of the day, the affected area will heal and normality will resume. That's by Christopher Reeve. A Bible verse to, in addition to the topic, for with God nothing shall be impossible. That's according to Luke chapter 1, verse 37. It's all about believing. With God nothing shall be impossible. Everything will be possible under the through the recovery process of the flood. So that has been my presentation as your mass educator today. I say thank you for your cooperation through this process since the beginning till now. Come to thank you. If you have any question, any query, go ahead and ask. No question. So thank you for your time. Thank you. Uh,
Imeisha.
uh, hey, Mish. Acha tungoje hadi hiyo masaa iishe.
So